I think salutogenic design's about designing for health rather than designing for illness. So it's focusing on well-being. And the key design principles that we at the Dementia Training Study Centre focus on are, well, there are 10 key design principles. So one of them is, how do we unobtrusively reduce risk? How do we design for a human scale? How do we design so people can see where they want to go and be seen? How do we reduce unhelpful stimulation? And how do we optimise the things that are helpful, so optimise helpful stimulation? We want to create a familiar environment. We want to provide spaces for privacy and community. We want to support movement and engagement, so give things for people to do, provide links to the community, and also provide for a way of life, so a vision for operational philosophy, and so that the building and the operation go hand in hand. So no, it doesn't have to be a costly process, and yes, they can very easily be applied in a healthcare acute setting. One of the key things is to think about it at the start of a design, and to be aware that if we apply these principles, it will be great for older people and people living with dementia, but actually really good for everyone, because they are things that relate to, how do I find my way? Where do I go now? What will I find if I head along this corridor? How do I feel? Is this familiar, or does it make me anxious? And I suppose, while I'd say it doesn't necessarily have to cost any money to apply the principles at the design stage, that's because it's about thinking. Of course, if you want to retrofit them or come back later, refurb, to think how can we apply these principles, then that might cost some money. But we typically do maintenance anyway, so we spend money on maintenance. But when we do maintenance, let's apply the principles. And the other thing to think about, of course, is, well, it might cost me money to change a wall finish or perhaps change a floor finish, but if people are becoming aggressive because they see that blue floor as a pool, then that's also a cost. So the question of what it costs, I think, also needs to be looked at in a bigger context. Two tools that we use a lot in our work at the DTSC. One is the environmental audit tool, and that's a tool that Richard Fleming, Ian Forbes and I developed a number of years ago. There is now a high care version, so that's really aimed at people who are less mobile. Both of them are available on the DTSC website. And also the King's Fund tool, so that's the EHE King's Fund tool. It's a UK-based tool that's specifically developed for acute settings. That's also a really good tool to use. I think my immediate answer would be no. That's not to say, again, we couldn't do something relatively easy. But in some ways, I feel a lot of focus can be on other areas that are extremely technical and require enormous skill and planning. And the complexity of a healthcare building is just enormous. But if at the end of the day someone can't see the basin to use it, then all that money that's been used and all that technical expertise is to some extent lost. So I think some of the very simple things, like, are we providing contrast? Can people find their way? Do we highlight important stimulation? Those sort of things aren't really being given the weight that I think would make an enormous difference to the patients, and that's something that it would be really good if we did that in the future. Some of the things I think to think about, how we can create salutogenic or enabling environments designed on these key design principles as we undertake maintenance. So as we do maintenance, that's money we're already spending. So from that point of view, it doesn't cost a lot. We also are able often to get grants for things, fundraiser. People will donate for a particular piece of artwork, which could provide a landmark, provide joy, provide a focus, so fill that need for highlighting important stimulation. I think, though, the other thing is too that another way we can apply those principles would be to reduce the amount of unwanted stimulation. So what notices have we got up? What stuff's around? And that's something we can do really, really easily. Again, it doesn't cost any money to take down signs that are old or signs that aren't relevant anymore. Just one comment I'd make is while we focus on reducing unwanted stimulation, we don't want to go to no stimulation. That's as unhelpful as having too much. So we need to be still highlighting things that are important. It's not about taking all the notices down so there's nothing. It's about creating an environment that is stimulating in the best way and in a way that's meaningful. So I think probably not surprisingly, I'm going to say the industry needs to focus more on designing and incorporating these principles. But if I were to pick one separate thing, I'd say let's think a bit more about placemaking. If we can give greater attention to creating a sense of place, I think then that will actually respond to all of the principles that I've been talking about, identity and meaning, and help people have a sense of well-being, and that will be really good for people's health.